Hello, everyone, and welcome to tonight's webinar hosted by the IPS Center for Psychological Services in Sterling, Virginia. Tonight, we'll be going over navigating and understanding psychological distress, which will be presented by our director and associate of the IPS Center. So we're really excited to have you. We will have a Q&A section at the end of tonight's webinar. And if you have any questions, please feel free to put them there. This event also will be recorded, so you can receive the recording via email if you have to drop off. So thank you again for attending tonight's presentation. I'm going to turn it over to Dr. Orellana, the director for the IPS Center. And we look forward to sharing this wonderful information with you that you can implement with your loved ones.
Hi, everyone. It's lovely to be with you tonight, and we're excited to talk with you a little bit about the IPS Center, but also about the impact of COVID and how you can help others understand and navigate all of the impact that they're feeling about what's going on. So I want to start by just introducing myself and Dr. Stefani, who will be speaking. So my name is Dr. Helena Orellana. I'm a graduate of, Dr. Stefani and I are both graduates actually of the Institute for Psychological Sciences here at DMU. I'm currently the director of the IPS Center, our on-site training clinic, and a clinical supervisor of the students who work here. Dr. Stefani works with me. She's the associate director of our clinic and also serves as a clinical supervisor. So the second half of our talk will be a little bit about what we do at our center and how it can relate to some of the things that Dr. Stefani is talking about. So without much more, I just want to introduce our topic, helping others understand and navigate psychological distress. And I'll turn it over to Dr. Stefani.
Yes, that would be helpful if I unmuted myself. So for the portion that you missed because I was on mute, I just wanted to acknowledge that it's good to be with you all and we appreciate you attending. And the first portion of the webinar tonight will be really offering some context about understanding how recent stressors have impacted us, specifically at a psychological level, how you can support people in your life and encourage them to reach out for additional support as needed. So I wanted to also name the elephant, or maybe not so much the elephant in the room, which is we're all connecting via Zoom, which has become in a lot of ways a normative part of our experience within the last year or so. And it's this constant reminder for us that so much has shifted in our lives in such a short period of time, and that in many ways we've adapted. And this offers something very valuable where we're able to stay connected with other people, where we've been able to continue in school, in work, in various ways when we weren't able to access things in person. And yet, as humans, we're embodied souls, which means that we're impacted by an in-person encounter in a way that's fundamentally different than when we connect virtually. And that this is a potent example of the significant changes that we've faced and how the experience within the past year has made it more challenging for us to stay grounded and feel hopeful in the midst of the circumstances. The past year has essentially been marked by uncertainty, anxiety, fear, grief, and loss. And this list is not exhaustive, but it's just to start to paint the picture of what feels so salient for us that wasn't necessarily the case a year and almost a year and a half ago now. the recent and current stressors, Dr. Orellana had mentioned COVID-19, and we're aware that that's also contextualized amongst other factors. So this global health pandemic, racial and political tension in our country and more globally, and then social unrest, whether that be at the community level, at the national level, internationally as well. And that as humans, we're wired for safety and connection. And then uncertainty and upheaval, when it's introduced into our daily lives, becomes a source of threat and has an effect on us. And what we know about fear and uncertainty is that it leads to a reduction in the sense that the world is safe and predictable, that we're no longer able to operate under the same assumptions when we're aware of this threat. And so our heads, our hearts, our bodies, and our souls respond differently when this sense of safety changes. So if we think about the larger factors and how that's impacted us, not feeling safe, not knowing what's predictable, that starts to shift the way we know how to respond. And in fact, we may be unsure how to respond to the stressors that we're facing. More specifically, what is evoked for us? And this comes out of both my own personal and also clinical observations in the people that I work with, as well as research, that there's this worry, fear, anxiety, loneliness, loss, and grief that starts to emerge, and that takes a toll on us physically, psychologically, and spiritually, that all these different ways were impacted. And it may be an impact that's new for us. Maybe prior to the pandemic, prior to these other stressors, we didn't wrestle with anxiety, and yet we find that showing up for us. And if we did have a pre-existing mental health concern or vulnerability, these situational circumstances are going to exacerbate that. And so how we respond is a heightened sense of fear and anxiety, maybe even anger in response to some of the situations, feelings of panic, or even wanting to isolate and withdraw, or having thoughts of death or suicide. That there's a way in which these dynamics start to bring to light these existential considerations, and there's these questions about meaning and purpose that get wrapped up into our psyche and start to affect the way we experience and view the world and even other people. And it might mean that we start to turn to poor coping mechanisms. One example might be using substances, whether that's drinking or drugs or video games, all sorts of different things to start to manage what's happening to us internally that may actually be detrimental in the long run for us. And what makes this experience different the past year, that in a certain sense, the ways that we typically cope that are adaptive and helpful were not or may still not be available and accessible. And the primary one being our relational and community support. And we know from research that social connection and support can buffer against stress, against difficulty in a way that other things don't necessarily measure up to. That isolation, in fact, is one of our deepest sources of pain, and that in the midst of our own suffering, it changes when someone else is present to us. And so within the pandemic, we become more distant, we become more isolated, and we don't have access to those same things that used to buffer against stressors, that used to help us weather the storm in a way that was very adaptive. So we have new challenges as a result. And I found this quote to be particularly poignant. We're denied the solace of community just when we need it most. That when we're facing something that's unprecedented and we want and need to lean on people in a way that we've done in the past and it's not available to us, that intensifies or it amplifies the distress that we feel. And I imagine that many of us have experienced, and many of us have watched this happen to our loved ones, to the people that we care about, that it's been so trying on our hearts, on our bodies, on our souls to not have that sense of connection with other people. Mental health in general, what we see is about 1 in 5 adults in the United States experience a mental illness or disorder in any given year. And then introducing the pandemic, the Center for Disease Control found that 40.9, almost half of the over 5,000 respondents that they surveyed reported an adverse mental or behavioral health condition that included symptoms of an anxiety or depressive disorder, trauma-related symptoms, or new or increased substance use or thoughts of suicide. Again, this is the amplifying of either pre-existing or new conditions that are emerging. And it just goes to show how much of an impact that this is having on us. And I want to take a moment to focus on 2 of the primary areas that we're seeing distress show up. And again, it's not to dismiss or discount the other ways, but it's to emphasize that anxiety and depression are probably 2 of the most common areas that we're seeing people struggle. And anxiety in general tends to be more future oriented, that I'm worried about what will happen, or I'm in my mind, I'm tracing these questions of what if this, what if that, and I find myself preoccupied by those concerns. And I have on here just a list of some of the key characteristics of or features of someone that's struggling with anxiety, that it's characterized by this sense of fear and worry that can be general or it can be specific. For example, someone that previously didn't struggle with anxiety may have very specific worries or fears about contracting an illness or being exposed to COVID or having a loved one or a family member get sick or ill, or even a small detection of a symptom that in the past may have been, oh, this is a cold, it's not necessarily a concern, but now there's this heightened awareness of, oh, this could be something very serious or detrimental, and I'm finding myself more worried or more concerned about those things. Feeling on edge or keyed up, having racing thoughts, difficulty making decisions. Again, this anxiety makes it really complicated to sort through what is a helpful choice for me in the moment. I may even become paralyzed by the anxiety. Having a really hard time concentrating, that often there's a lot happening internally that it's really hard to focus. For example, if I'm at work and I've been asked to do something, I'm distracted by all that I'm worrying or fearful of, and it's hard to concentrate. There are often physiological symptoms, maybe a racing heart, sweating, kind of pain in your chest or a sense of tightness, overall muscle pain or tension, having gastrointestinal issues. We know that anxiety is often linked to gut reactions of a knot in the stomach or losing your appetite, because the neurotransmitters related to anxiety can stimulate those receptors. And so we lose our appetite, which then can further exacerbate the anxiety. A sense of loss of control, or even escalating to the point of having panic attacks, either on one occasion or occurring multiple times, and then a fear of having those panic attacks. Depression, compared to anxiety, is often a focus on the past. So dwelling in what has happened and maybe even ruminating on that, mulling it over in your mind, or a sense of brooding about that. That it's characterized by sadness, low mood, a lack of motivation, fatigue, and that could be both mental and physical fatigue. Again, a difficulty concentrating. So you see that there's overlap between these 2, that they're not necessarily discrete, but just wanting to frame out what characterizes each. disruptive sleep. That could be a difficulty falling asleep, staying asleep, waking up very early in the morning, having difficulty falling back asleep, or excessive sleep, finding that you're taking a lot of naps or that you can't get enough sleep, changes in eating or weight. And that can be either an increase, so overeating, or it can be a decrease, not eating enough, weight gain, weight loss. Then a lack of interest or pleasure in activities that you typically enjoyed. For example, if you like to take walks, or that's something that maybe you do with your spouse, for example, and then you notice that your spouse says, I'm not really interested, I don't feel up for it, that could be part of depression of I'm not interested. And that can be in also more extreme forms as far as I just don't really feel interested in anything. A sense of excessive guilt that seems out of proportion to the circumstances, that we all may feel guilty about something that we've done, but an excessive guilt that really starts to dominate their experience, feelings of worthlessness or hopelessness, and then suicidal thoughts of wishing you maybe weren't here or wanting to do something to not be here because things feel so hard that there's so much pain present. I also want to take some time to reflect on grief and loss and how that has shown up for us, that right now there are many things that we're mourning. That could be death of loved ones, it could be loss of jobs, lost savings, lost security. Again, in what was predictable, what was known in the world has dramatically shifted and changed for us. A loss of certain milestones, such as graduations or weddings. They may have taken place or they may have been postponed or rescheduled, but it's changed our expectation of if and when those things happened. And then also something that I'm going to say more about is just our day-to-day routine has been uprooted, and that can feel very destabilizing for us. And at times we don't recognize or we don't pair the lack of routine with this sense of loss or a way in which we are really feeling the pain of what it means to not have a rhythm that we used to be able to rely on in our day-to-day lives, and that we're having to constantly update and change this routine. And that there's an overall, what some people have called collective grief, that we're grieving the loss of what we imagined were our relatively safe, stable, and protective lives. That now we've had to question that, and we don't have the same sense of stability as we used to have. More about the unique challenges of this past year, that it's been a universal and shared experience, and that because everyone, quote, is going through it, it can end up invalidating what feels difficult. There may be this tendency to look around and compare, well, we're all going through this, and that person doesn't seem to be struggling as much as I am, or as much as this person that I really care about, that maybe there's something wrong with me, or maybe I should be stronger or more resilient in the face of this, which then can be dismissive or invalidating of what does feel very difficult for us. And then it doesn't leave space for us to consider what I might need or what changes may be necessary, what type of support feels important as I navigate these challenges. The change that we're facing is also a change that is ongoing and unpredictable. So there's many times in which we experience changes in our life, and adjustment to those examples may be starting college, getting married, moving to a new location, or changing jobs. It typically takes us about 3 to 6 months to adjust, but that implies that the change has occurred and now you're situated in the reality and you're adapting, you're adjusting, you're learning what's new about that change. The change we're going through right now is very different. And I want to share a quote, which was from that same article that I quoted earlier. The writer states, "We've been given no timeline, and that's another special challenge of this crisis. It's rolling rather than fixed, diffuse instead of discrete. It resists the drawing of any parameters around it. We have no idea what we will ultimately be asked of us, so we can't know what new emotional muscles to build, how strong they must be, and what pace to take." That we can't rely on what we know because there's this constant updating and revision, that in a way it's this chronic change which has an erosive impact on us, and it's psychologically harder to navigate. And in addition to this ongoing unpredictable change, that ordinary decisions and choices have become charged for us. That the idea of going to run errands, going to the grocery store comes with this whole new layer of, who am I going to take with me? Is it safe for me to take my children? Will I be wearing a mask? Will other people in the store be wearing a mask? How many people will be there? What is their protocol when I arrive? That there's so much cognitive and emotional effort that goes into each of these small decisions, moment to moment, day after day, that starts to wear on us, and that those decisions activate this worry and this anxiety and this fear that then stays with us, and it's salient, and it taps our resources, and we have less time and less ability to renew and replenish and restore those resources because we're constantly being asked to utilize them in a way that we didn't have to previously. So coping well and building resilience in the midst of this change. The first part I want to talk about is the process of coping well. And the first piece is to talk about the changes, that it's happening. And if we just expect ourselves to adapt without first talking about it and honoring and acknowledging the reality, it's going to be so much harder to identify what we might need to cope well. So the first part of the process is to talk about the changes. That may be with a friend, with a loved one, with your family, with your children, with people in your community. What is different? What has changed for you? And that may even vary for each person. And then identifying how you are being impacted. What are the things that have gone well despite the challenges? What have you drawn from this that's been meaningful? I know for many of us in quarantine, for example, we maybe spent more time with our families, that we didn't have to commute to work. We weren't out of sync with one another, that we actually had this opportunity to bond, to connect, which also came with challenges. But it's not necessarily all a negative impact, but just knowing, how am I being impacted? And then naming and expressing what does feel difficult. And then, as I mentioned before, we're created to be in relation with one another, and isolation is so painful for us on a human level that we want to stay connected. That there may be this tendency of, I know for many of us, I'll speak for myself, after spending 8 hours on Zoom, I feel really fatigued, and the idea of getting on another Zoom call with my friends, with the people that I care about, feels exhausting. And so I have to be creative about ways that I can safely connect with them so that my resources are being replenished. And then knowing, when do we reach out for support? And Dr. Orellana is going to talk a little bit more about that in her segment. I also want to offer some practicals. I mentioned that there's been a big shift in our routine, and it's so important for each of us to be intentional about establishing a routine, finding these daily anchors. Is it the case that you get up and the first thing that you do is maybe you spend some time reflecting, maybe you spend some time with a morning cup of coffee or tea and you reflect on the day? that you pray, that you offer gratitude, or maybe you go for a walk. Maybe you check in on your children. Maybe you talk with your spouse about what's our plan for the day. But building in these routines, these anchors, maybe you set a time to have lunch every day. Maybe you have a time planned in your day to exercise or to go out of the house and take a walk. And setting boundaries for yourself, boundaries on time, boundaries on space, and boundaries on activity. And what I mean by that is because a lot of our lives take place under the same roof. Some of us may be working remotely. Our children may be going to school out of the home. Our spouse may also be working. That we need to set boundaries on. I am working from 9 a.m. to 5 p.m. And that at 5 p.m., that's the end of my workday. And even though I'm in the same space, I'm going to mentally shift to how I'm spending my time, which is engaging with my family, for example, or it's going out for a run, or it's going to visit the church and spend some time in prayer, that I'm no longer working. There's more of a tendency for our boundaries to be blurred in that way of, oh, it's 9 p.m., I'll check this email, it's not a big deal. But actually that can be challenging to then feel that your time is being protected, that you're able to attend to the other important areas of your life. And then also space. I know for adolescents in particular who are virtual going to school, maybe they're going to school and they're sitting in their bed and they're going to school. And then at night when they have to go to sleep, it feels a lot harder to wind down, to decompress. And so actually having boundaries around, here's where I sleep at night. I have a desk in the corner of my room, or I always sit in this chair when I'm in school, can actually be really beneficial to help us separate the modes that we're in so that we're not carrying all of our schoolwork when we're trying to fall asleep, or we're not, sitting in our living room where we spend time with family and being confused about, am I supposed to be focusing on work right now? No, I'm with my family. And then same thing with those activities. When you're spending time with those, where you're doing that, but being really intentional about when that happens and planning to do them so other things don't take over that opportunity. And another really important piece is to practice gratitude. We know in the research and in our lived experience that in times of suffering and in times of distress, actually being intentional about listening to music, reading poetry, or reading things that can evoke this sense of gratitude has a positive effect on our mental and psychological health. And I actually think that the Psalms are a really beautiful example of capturing so much of this picture, which there's typically some type of lament or some crying out or anguish that acknowledges the pain and the suffering, that it's so important to make space for that, that we don't have to cover it up or we don't have to deny it, actually naming it and expressing it. And then that's followed by this sense of offering praise or thanksgiving, which in a way starts to instill a sense of hope for us, which is so important and so needed in these very difficult times. Other ways to help for yourself or other people foster mental health, I've said be intentional a number of times, and that includes attending to all aspects of our well-being. We know that each part of our personhood is so integrated that the effect on one is going to affect the other. And so when we're taking care of ourselves, we're doing that in all of these different areas. Our physical self, getting regular exercise, eating healthy, fresh air. And a lot of this probably sounds familiar to it. And some of you may be wondering, why are we reiterating what we already know to be helpful? Or maybe this is new for some of you. This idea, though, we can lose sight of these things, especially when we're feeling stressed, when we're feeling exhausted, to go back to the fundamentals and to do those things well, because that actually optimizes our ability to face stressors and to manage our emotions when we're taking care of our bodies, when we're getting nourished properly. And we know the effect that vitamin D, when we get sunshine, when we get fresh air, that has on our endorphins, that it boosts our mood and that it helps buffer against what feels difficult. And then emotionally acknowledging, naming, and expressing how we're feeling. And for you, that may be talking with someone, it may be journaling, it may be seeking therapy, that there's all sorts of different ways. The important point is not to hold on to that, not to store that just in ourselves, but to care for us emotionally means to have a way to process this, to have a way to express it, and that it alleviates the weight of the emotional impact. If we hold on to it, it starts to get heavier, but when we express it, when we share it, it changes the way it feels for us. And then relationally, connecting with other people. And that is such an important antidote to the loneliness and to the isolation. And spiritually, spending time in prayer or reflection, however that may look for you, that can be a source of strength and hope, especially if we are isolated or if we are disconnected from some of these in-person encounters or communities, that we don't have as much access to that a spiritual connection can also be very powerful, help us stay grounded, help us to stay rooted, especially as those existential questions come up for us when we're facing these difficulties. In terms of recognizing signs of distress and clinical concern, there are a few key aspects, and one would be changes. And this is primarily negative changes or changes that are adding to or increasing our level of suffering, changes in day-to-day behaviors and emotions. And then when these start to interfere with our ability to function in daily life. If you've noticed, for example, someone who typically doesn't have difficulties in work, but they say, I'm feeling really down, I'm not feeling motivated, I just don't really care about my work anymore. That's a noticeable change to how things were going for them previously. Or, yeah, I don't really have an appetite, I don't really feel like getting out of bed, I feel much more sad, or I find myself crying often. Those are signs. And some kind of key warning signs would be any changes in sleep, eating, the level of engagement or interest in activities, excessive anxiety or panic. All of us to some degree get anxious. When that starts to become very intense or prolonged, then we're starting to wonder, is this reaching a point where we're concerned at a clinical level? Similar for feelings of sadness, or even when despair starts to show up, a sense of isolation or withdrawal from daily activities, self-harm or suicidal thoughts, which those can emerge for all sorts of different reasons, but it's a sign for us that there is pain, there is some suffering, and we want to be able to offer support or help someone connect to support. And then those maladaptive coping patterns that I mentioned earlier, substance use being one, and the word or the term self-medicate may be used on occasion. And what that's conveying is this sense of there's something happening for me on an internal psychological level. I have pain that I'm needing to do something to manage that, to cope with it. And this is the option that I'm choosing, which may not necessarily be helpful in the long run, but it's meeting some need for me. So how do we support people? How I've synthesized this is the idea of first listening, being able to accompany them, and then helping to connect them. The first part is being a supportive presence and offering empathy, which means coming alongside them, being present to them and listening. All of us have this tendency when someone is in distress or when they feel worried, anxious, afraid, depressed, we want to do something to make it better, which means that we may lead with solutions or almost immediately offering, well, do this or try this, because it's hard to watch somebody we care about suffering. What we know is so important and so powerful is to first understand, to first clarify, get to know what's happening for them before you reach for a solution. Sometimes just being heard and being validated, even on a neurological level, can be so soothing to our attachment system that for you to offer a listening ear, for you to be empathic, can do so much for their healing, so much for what they're needing in that moment of pain. The second part of that, as you're supporting them, is to model boundaries, which all of us in our humanness are limited, that we're not going to be able to offer a perfect response. And that prior to supporting someone, knowing what am I willing or able to do? What am I not willing or capable of doing? And that it's okay and it's appropriate to have those boundaries, that you want to be taking care of yourself in the same way. And that maybe you are able to take a phone call at 11 p.m. and talk through someone's suffering or someone's pain. Maybe you feel like you're not able to do that. So the other piece that I'll talk about is knowing how to connect someone. So it's okay to feel human. It's okay to not have the answers, to feel limited in the way that you can support. And actually, you modeling that can be very important and powerful for someone. In terms of accompanying them, it's also helpful to identify strategies and support persons that they do have, bringing their mind to what they already do know, which is what's most helpful when you are struggling. That sometimes we're in a place of distress. It's hard to remember, oh, I do know that actually listening to music, oh, if I go for a walk, these are things that do help me, that we may lose sight of that. So having a conversation and thinking through that, and then asking them, who are the people that can support you? Perhaps you're one of those people, but also, are there friends? Are there family? Is there a pastor? Is there a mental health professional that's in your life or that you would consider reaching out to that could support you? And that brings me to the third piece, which is encouraging them to take care of the whole self, that idea of the physical, emotional, relational, spiritual, and then also connecting them with additional resources. And to be open to discussing questions, concerns, fears, or even misconceptions that they may have about seeking professional help. And one of the things we're wanting to do tonight is to help inform you about psychological services. So if people have questions, if they have skepticism, that you can start to answer that and you can point them in the right direction, to encourage them to call and schedule an initial appointment, which actually is often the most difficult step for people to make for a variety of reasons. It could be, I had a bad experience in the past. I'm apprehensive about that. I don't know what therapy is. I especially don't know what teletherapy is and how that will feel. So to encourage them to make that call and say, why don't you reach out? And if you have questions, people will be happy to answer those. I know that's true for us at the IPS Center. And so you're first listening, you're being an empathic presence, you're reminding them of helpful ways that they've supported themselves, and you're helping them connect with additional resources as needed. With that said, and I know we'll have time for questions at the end, I'm going to turn it over to Dr. Orellana to talk a little bit more about how the IPS Center in particular can help.
Thanks, Dr. Stefani. That was a really helpful way of understanding what's going on for people and some of the steps that we can take. I'm going to talk to you a little bit about who we are at the IPS Center and how we can help. And my hope is that this can provide maybe a template for understanding how other therapists and other clinics, perhaps in your area, could be helpful to you or your loved ones. So most basically, we are, the next slide. It's not showing up. Our mission at the center is twofold. So the most important piece of that is to provide our community, which has been expanded to the whole of Virginia, with affordable, high quality therapy, mental health care, and treatment. So we incorporate the best of psychology with an understanding of each person is unique. They've been impacted in in a unique way. They come from a unique system, and they have unique histories. And how do you blend the two? So how can we bring the best of psychology into your personal world and find strategies and solutions and bring healing to places of darkness and suffering? Our vision is to incorporate a deep respect for the dignity of each person and a commitment to providing the best of psychology to each person, regardless of their background and what suffering has brought them in. So with that, what makes us a little bit more unique is that unlike other kind of private practices or hospital settings, our practitioners are actually the graduate students of DMU's Institute for the Psychological Sciences. That's our clinical psychology program where students are working on their doctorates. So all of our clinicians are trainees. They're in the process of learning and taking classes as well as learning the art of psychotherapy. And in order to do that, they're all under the supervision of licensed clinical psychologists like myself and Dr. Stefani, who oversee in a very careful and methodical way the work they're doing in order to make sure that our clients are getting the best care possible, but also making sure that our students are learning these arts well. So with that, currently we're offering telehealth appointments and no on-site appointments, and we have availability immediately for adult individual therapy for people located in Virginia. So you'll see this a lot in other practices. It's kind of a good moment to generalize what's happening here. With all the complexities of being part of a larger system, we can't open immediately we haven't been able to open for on-site care. And our hope is that that will shift soon, especially as things start to open up. But right now we're offering telehealth appointments. And so the advantage of that is that now allows us to see anyone in the state of Virginia. So that's one of the really nice benefits, and something that to consider as you think about a therapist is, might there be someone who I feel more comfortable with within my state, even though I might not be able to find someone immediately kind of in the next town or in my current town. So what does our process look like? So if somebody's interested in services, have a sense of, yeah, I have been really impacted by the past year, or I just feel very stuck in my life. How do they get help? Well, we have a kind of threefold process here at the center. And our overall goal is to make sure that we have a good sense of what you need and a good sense of whether we can be helpful. So the first step in that is for anyone interested to call and complete an initial phone screening, where we get a little bit of a sense of who you are, what's bringing you to therapy, what you're hoping to gain, and ask a couple background questions to make sure we have a good sense of what might be going on. Then we review that information and we think through, like, okay, if this is what's bringing someone in, can we be helpful? Are our clinicians able to really walk alongside someone with this and help them heal in this area? And if we do feel like we're a good fit, then we set up an initial appointment. And if we feel like we aren't a good fit, or we know somebody who's a better fit, we'll work with you to get you established with them. So let's say you are a good fit. The first couple meetings are, in our model, highly collaborative. It's kind of a mutual process where we're getting a lot more information. The client and the clinician are working hard to see, like, what is really going on here and what are the steps or the goals that you want. And we use that to decide, kind of each on our own, like, can we do that? Do you feel like the IPS Center can do that for you? And do we feel like we have the tools and the time and the training to be able to help you get to those goals? So then we kind of decide together what's best and what's going to be most helpful. And from there, we kind of begin treatment. So each practice here has their own process. So some don't have the initial phone screening. They start with an initial appointment. Others have a similar phone screening and the referral process. But typically there's going to be some kind of conversation about, what are you looking for? What times are you available? How would you like to go about this? One thing kind of in the next slide that we'll talk about is concerns that we here at the IPS Center can be helpful with. And each practice and each clinician has their own sense of concerns that they know are kind of in their wheelhouse, that they've tried and true, know how to help and things that they're good at. Here at the center, we work very well with clients who are experiencing anxiety and panic, depression, issues of self-esteem, self-confidence, difficulties with adjustment and loss, which are particularly timely, as Dr. Stefani talked about. Trauma and stress-related difficulties, again, quite timely. Relationship concerns, parenting problems and child behavior management, self-improvement and insight. I do want to kind of echo some of what Dr. Stefani said by highlighting that a lot of what we're seeing are people who don't feel necessarily like they're depressed or anxious, meaning having panic attacks, although we do see that people who struggle with that are struggling with it so much more. But what we're really seeing clinically is people feel quite lost or feel quite stuck, that their lives have kind of frozen in this place of everything keeps changing, and yet I'm still stuck in my house, or I'm not having all the things, not back to life as normal or the new normal. And this is kind of one of those areas where therapy can actually be really helpful. It doesn't have to be long-term. It could be a few sessions, a few meetings where you're really talking through like, what is the impact on you? And coming up with a tailored understanding of what you might need because of that. And especially having someone outside of your home, let's say, or outside of your network who can help you be honest about how your relationships have been impacted, how your home life has been impacted, can really bring a lot of light into the confusion and murkiness there. And that's something that we've been seeing come up for people a lot more over the past year, and something we've seen that we've been able to be really helpful with and successful and provide a lot of success for people. The last thing I wanted to touch on is our fees and hours of operation. So each clinic has its own kind of set fees. And one of the advantages of being a training clinic is that we're able to offer a sliding scale. It's based on income and the number of people dependent on that income. And typically it's anywhere between $20 and $50 per session, which is very, very reduced, particularly in the DC and Virginia area, but certainly around the country. At our clinic, our hours of operation are Monday, Wednesday, and Thursday, 9 a.m. to 7 p.m. as appointments are available, and Friday, 9 a.m. to 5 p.m. again as appointments are available. We only do appointments only, and like I mentioned, we have that phone screening process, so we don't do walk-ins or kind of emergency appointments. So each clinic will have their own version of this. Some practitioners will take insurance, some won't, some have higher fees, but have a sliding scale within that range. And each clinician kind of has their own schedule. But I think it's best to call and talk with them about that, because that can be a deciding factor. What are the fees? And it's perfectly all right to ask and to say, hey, I don't know how this will work financially. Let's talk through like what your options are. And one of the biggest recommendations that I give to people is, even if that person that you call doesn't work, ask them if they know somebody who might be a good fit for you. Ask them to give you additional resources, because they might be more connected, and they might have trusted colleagues, for example, who they know have some availability. This is something that we work with a lot here at the center, is even if we can't be helpful, we want to make sure we give you options to look for care. If you're calling us, you're making the right move. And so we want to help you make that, kind of get to the place where you will be best helped. All right, that was a lot of information in a tight amount of time. So now I want to open it up for questions and answers. And Dr. Stefani and I can kind of trade off answering some of your questions. So feel free to put them in the Q&A box, and Dr. Stefani and I will look through them now to see if there's anything we can talk through with you all.
I started to respond to some of them, and if anyone who got a response would like us to elaborate, happy to do so, but wanted to be able to at least offer a comment to you. All right, I see a question about where our clinics are located, and our one clinic is in Sterling, Virginia. And as Dr. Orellana mentioned, because we're offering telehealth services, we are able to reach clients who live in Virginia, so they can be remote from us. If and when we do return to in-person services, those that are very far away, it might be more of a challenge. But while we're physically in Sterling, Virginia, we can serve anyone in the Virginia area at this point in time.
I saw that you answered a question about talking with teens. I think that's such
Yeah.
a timely one and certainly a really challenging question. Dr. Stefani, you responded in the chat by saying it's so hard, gently checking in and creating the space to talk, as well as really offering empathy versus offering kind of an immediate solution. So really listening and hearing them out on their own terms. It can be very hard because we can disagree with their terms, but making sure they feel heard before you step into offering your own opinion is a big step. One kind of different strategy that I would offer is face-to-face direct eye contact. Conversations can be quite challenging. Even in therapy, as clinicians, we're mindful of that. We talk with in training about like, you can't just like stare at somebody. That's pretty intimidating and pretty intense. So one of the things that research has shown is that in fact, better, harder conversations happen when people are facing the same direction. So one of the things that I like to recommend to parents is go on a walk. Just be quiet. And even if you have a totally silent walk, hey, that's something. But walking, so getting your bodies moving and getting energy out that way, as well as offering a little bit of visual distance, can typically help teenagers to talk a little bit more and help us to kind of listen before responding and changing things.
And one other piece that I would add is, I know I'm giving the recommendation of talking through and processing what feels difficult. I think with teens, they need a little warm up. So if you ultimately are curious about what's going on for them, maybe at a deeper level, or are they doing okay, I would recommend starting with something more benign that maybe is of their interest or something that's relevant for their life as kind of an opportunity to connect and build that sense of trust with them. And then you can gravitate towards some of the others, in addition to having something to do while you're having the conversation.
One of the other questions that I see here is asking if we work with particular modalities. So that can be like different treatment approaches. So they listed cognitive behavioral therapy, EMDR, et cetera. For the most part, we don't work with one particular modality. And again, it's that collaborative approach. So a lot of what we do is we work to really understand what the client is looking for, what they would like to focus on. And then we bring to that the modalities that we think will be most helpful. So CBT is something we're familiar with and has been brought into sessions here, but we also work on more kind of affectively focused treatments. So there's not kind of an easy, quick answer, but the idea is really what does the client need and would find most helpful.
I also see a question about offering services to, I'm guessing the MDS Maryland clients close to the district. So because of our jurisdiction and licensing, we're only able to provide services if they're located in Virginia, which in an area such as DC, Maryland, and Virginia feels unfortunate because some people are very close in proximity. Unfortunately, though, we're not able to, with our license, practice across state lines. So we wouldn't be able to. We could certainly offer referrals, though, if they did call us. And then if we opened for in-person services, they could come to us and be located in Virginia. And then, yes, this webinar is being recorded, I believe. Yeah.
I think a copy will be sent automatically, but it will definitely be up on our website, and we can make sure to get you a copy. There's another question about asking if one of the parents and the teen are both depressed, will the same psychologist help both of them? It's a really good question. that I think is pretty practice specific. So at some practices, the clinician, the psychologist will work with both of them kind of one-on-one and then maybe even together as needed. At our clinic, we have, if that came up, they would be seen by separate clinicians just to make sure that both felt that they had a space kind of and a person who was working with them and helping to understand them. But then the two clinicians could coordinate as needed to make sure the whole family system was getting what they were needing. So not an easy answer either way. It really kind of depends. And it's something that the parent and team could think through and talk with their clinician about what they're looking for. All right. I think we have a few more minutes if anyone else has a question.
There's a question about guiding someone to find a good fit with a therapist if they struggle to match with therapists in the past, and a very hard dynamic, and also not uncommon that it can be a process to find a clinician that's a good fit. And I don't say that to discourage people. I say that to acknowledge that finding someone who is a good fit is such an important part of the process, and it may not happen the first time. And to encourage someone to be open to that process, and also it's something that can be discussed with the clinician. And that's something that we really emphasize and invite, as far as it's not us making a determination of, yes, this is a good fit and therefore you must work with this clinician, but also how is this for the person? And if it's not a good fit, we do our very best to connect them with someone else. And it can feel hard that it takes a couple of times, and also very worth it, because the therapeutic relation is such a fundamental part of the overall process. Yeah, so to normalize that, yeah, it can feel hard, especially if you've had a bad experience in the past. It's discouraging to reach out again, and yet there, ultimately is a pathway and finding someone who is a good fit for them.
Someone has asked if we think that pets, mainly dogs, are helpful. I think this is a really interesting question, and something that we're really working on in the field to understand, kind of with the rise of emotional support animals, in contrast to kind of service animals. And my sense, and I'm not as kind of read up on the literature as perhaps I could be, is like common experience, pets are very helpful. And I found a lot of clients talk about how, even, especially in the pandemic, the routine of having a pet has been really grounding. And even pets have brought a lot of humor to Zoom meetings. I know mine has brought a lot of humor to my own. So I do think that there's space there that kind of on an experiential level, people do find pets helpful. And I myself, having worked in a VA with a lot of veterans, have found that highly trained service animals are profoundly helpful in the work that they can do for veterans who are suffering physically and mentally. So it's not exactly a definitive answer. I think it's something that as a field we're trying to sort out, but I think kind of even in the clients that I work with, we try and make use of those resources if they are helpful for someone who is feeling overwhelmed. All right. I think that's just about time. Thank you all so much for coming. It was lovely to kind of talk with you a little bit, to share about our mission that I know Dr. Stefani and I feel incredibly passionate about: mental health and helping people heal, but also about the work that we do at the center. So just wanted to thank you all. Dr. Stefani, is there anything you wanted to add?
I would echo the thanks, and appreciate your questions and your attendance and investment in our work. And we really are here to serve the community. So please feel free to reach out to us.
Thank you all again, and take care. Have a lovely night.
All right, you all too. And if you could just share your phone number and the best email for the IPS Center. And I know that we have some resources that we can mail to everyone.
Yeah,
So
Thanks, Ebony. I forgot to do this. Yes. So if you want to learn more about our clinic, we're at the ipscenter.org. But you are welcome to call us. That's our number there, 703-418-2111. Or email us at ipscenter@divinemercy.edu. And that's if you are interested in coming and working with us, if you have a loved one or someone you know who might be helped by our clinic, but also if you want some resources from us, if that's referrals, or even if we can send you flyers to share with your community, we would be more than happy to do that. There's a variety of ways in which we can serve. Therapy is kind of the main one that we can do, but also just being a resource is certainly something we're very passionate about. Thanks, Ebony, for the reminder. I appreciate it.
All right, you're welcome. All right, and this ends our webinar tonight. Thank you, doctors. We will be sending out the recording by Monday, so look out for it via email, and then you can go back through it as you please. You all have a good night, and we thank you all for your time.